Hi, I'm Garvin. This telecast is on protium, or Pantoprazole is the chemical ingredient. So protium is used to treat certain conditions caused by too much acid being produced in the stomach. So how does protium work? Acid is produced naturally in your stomach to help you digest food and to kill bacteria. This acid is irritant, so your body produces a natural mucus barrier which protects the lining of your stomach. In some people, this barrier may have broken down, allowing the acid to damage the stomach, causing inflammation, ulcers and other conditions. In other people, there may be a problem with the muscular band at the top of the stomach that keeps the stomach tightly closed. This may allow the acid to escape and irritate the esophagus. This is called acid reflux and can cause heartburn or esophagitis. So proton pump inhibitors such as protium stop cells in the lining of the stomach from producing too much acid. This can help prevent ulcers from forming or assist the healing process. By decreasing the amount of acid, they can also help to reduce acid reflux related symptoms such as heartburn. Protium can also be used to treat irritation and ulceration of the stomach caused by non-steroidal anti-inflammatory drugs. It can also be used as one part of a treatment to get rid of Helicobacter pylori, a bacterium found in the stomach, which can cause ulcers. So how to take protium? Before starting this treatment, read the manufacturer's printed information leaflet from inside the pack. Take protium exactly as your doctor has told you to. Try to take protium at the same time each day to avoid missing any doses. The usual dose is once a day in the morning. However, if you are taking protium for Helicobacter pylori eradication, you will be asked to take 2 doses a day, one in the morning and one in the evening. Swallow protium tablets whole. Do not chew or crush the tablets. Take each dose an hour before a meal. If you forget to take a dose, take it as soon as you remember, unless it is nearly time for your next dose, in which case, leave out the missed dose. Do not take 2 doses together to make up for a forgotten dose. So what is protium used for? It's used for gastroesophageal reflux disease, including treatment of symptoms such as heartburn, acid regurgitation and pain on swallowing, and long-term management of reflux esophagitis. It's also used for treating peptic ulcers, preventing peptic ulcers in people who need continued treatment with non-steroidal anti-inflammatories, painkillers, and are at risk of ulcers, and eradicating a type of bacteria called Helicobacter pylori from the gut of people with peptic ulcer, in combination with other antibiotics. Excessive secretion of stomach acid due to a tumour or enlargement of the pancreas, which is Zollinger-Ellison syndrome. So use protium with caution in people with decreased kidney function, decreased liver function, people with osteoporosis or who are at risk of osteoporosis. For example, people taking long-term corticosteroid medicines and women who have passed the menopause. This medicine may increase the risk of breaking a bone. Also, vitamin B12 deficiency. So do not use protium in children under 12 years of age. This medicine should not be used if you are allergic to any of its ingredients. Please inform your doctor or pharmacist if you have experienced such an allergy. If you feel you have experienced an allergic reaction, stop using the medicine and inform your doctor or pharmacist immediately. So, what about pregnancy and breastfeeding? So, certain medicines should not be used during pregnancy or breastfeeding. However, other medicines may be safely used in pregnancy or breastfeeding, providing the benefits to the mother outweigh the risks to the unborn baby. Always inform your doctor if you're pregnant or planning a pregnancy before using any medication. The safety of this medicine for use during pregnancy has not been established. It should only be used during pregnancy if the expected benefit to the mother is greater than any possible risk to the developing baby. Seek medical advice from your doctor or pharmacist. This medicine may pass into breast milk. It should only be used in women who are breastfeeding if the expected benefit to the mother is greater than any possible risk to the nursing infant. Again, seek medical advice from your doctor. So side effects. Medicines and their possible side effects can affect individual people in different ways. The following are some of the side effects that are known to be associated with this medicine. Just because a side effect is stated here does not mean people using this medicine will experience that or any side effect. So, common would be headache, disturbance of the gut such as diarrhea, constipation, abdominal pain or discomfort, bloating and wind, dry mouth, dizziness, sleep disorders, skin reactions such as a rash, feeling weak, tired or generally unwell, increased liver enzymes. Also rarer side effects would be blurred vision, increased levels of fats called cholesterol or triglycerides in the blood, weight changes, taste disturbances, depression, pain in the muscles or joints, swollen ankles due to fluid retention, breast swelling in men, increased body temperature, and very rare side effects would be confusion, hallucinations, decreased number of white blood cells or platelets in the blood. Also decreased level of sodium in the blood, which would be hyponatremia. Decreased level of magnesium in the blood, which would be hypomagnesemia. Liver problems, jaundice, kidney inflammation, which would be interstitial nephritis. Increased sensitivity of the skin to UV light or photosensitivity, and severe skin reactions. So how can this medicine affect other medicines? You should tell your doctor or pharmacist what medicines you are already taking, including those bought without a prescription and herbal medicines, before you start treatment with this medicine. Similarly, check with your doctor or pharmacist before taking any new medicines while taking this medicine to make sure that the combination is safe. Protium should not be taken by people taking the anti-HIV medicines atazanavir or rilpivirine. This is because protium reduces the absorption of these medicines from the gut and could make them less effective at treating HIV infection. Proton pump inhibitors such as protium are not recommended for people taking the anti-HIV medicine raltegravir or saquinavir because they may increase the blood level of these medicines and may therefore increase the risk of their side effects. Due to its effect on the acidity of the stomach, protium may reduce the absorption of the following medicines from the stomach, which could make them less effective: erlotinib, itraconazole, ketoconazole, lapatinib, pazopanib, pazocanazole, ulipristal. This medicine may enhance the anticoagulant clotting effect of anticoagulant medicines such as warfarin. As this could increase the risk of bleeding, if you're taking warfarin, your doctor may want to perform extra monitoring of your blood clotting time when you start and stop treatment with this medicine, or if you take it irregularly. There may be a greater chance of a level of magnesium in your blood falling too low if you are taking this medicine with digoxin, diuretics such as benzoyl-methiazide or furosemide, or other medicines that can lower blood magnesium levels. If you're taking one of these, your doctor may want you to have blood tests to check your magnesium levels before you start taking protium and then regularly during treatment. So how do you store your protium tablets? You keep all medicines out of reach and sight of children. Store in a cool, dry place away from direct heat and direct sunlight. So if you have any questions, you can ask me through the live pharmacist on the website. You can email me or call into Lynch's Pharmacy in Cork. Thank you for watching and have a nice day.